RANZCOG acknowledges and pays respect to the traditional custodians of the lands, waters and communities across Australia on which our members live and work, and to their elders, past, present and future. Good evening and welcome to the live stream of this Q&A, COVID vaccination in pregnancy, breastfeeding and those planning to be pregnant, with Dr. Vijay Roach and Dr. Clare Whitehead. Thank you very much for the opportunity to present on this important topic. My name is Andre Curry. I look after communications at the Royal Australian and New Zealand College of Obstetricians and Gynecologists. Before I introduce Vijay and Clare, a couple of housekeeping things from me. The first part of this event will be short presentations from Vijay and Clare before moving on to questions submitted to us prior to tonight. You can ask questions in real time. Please do. And Vijay and Clare will do their best to answer, time permitting. And please, let's be mindful of being respectful in the conversations and chats that we have tonight. So who are our speakers? Clare is an obstetrician at the Royal Women's Hospital in Melbourne. As well as being a fellow of RANZCOG, Clare is Deputy Co-Chair of the Pregnancy and Perinatal Care Panel of the Australian Government's National COVID-19 Clinical Evidence Taskforce. Vijay is an obstetrician and gynecologist who works both in private and public practice in Sydney. He has been the president of RANZCOG since November 2018. Vijay is co-chair of the Pregnancy and Perinatal Care Panel of the Australian Government's National COVID-19 Clinical Evidence Taskforce. And now here is Vijay and Clare.
Thanks very much, Andre. Thank you for that introduction. And thank you to all of you for the opportunity to talk to you. And I think that's actually important that you hear that message to begin with, is that we want to share with you what we know. We want to share with you what we understand. We don't want to tell you what to do. We don't even, in a sense, almost want to give you a recommendation. We want to give you the knowledge that we've accumulated over time. And of course, that has meant so many questions, so many doubts, so many things that we've had to read and digest. But the people that we work with are extraordinary. The level of evidence that we have been considering is extraordinary. And we have therefore arrived at a certain point in which we feel that we can give the advice that you have read that RANZCOG and ATAGI have given, which is that vaccination in pregnancy for COVID-19 is safe, and that it is, I said I wouldn't recommend, but that we recommend it for all pregnant women, and that outside of pregnancy, if you're planning to be pregnant or you're breastfeeding, that we don't have evidence of vaccination carries a risk, and of course it protects you from the disease. So to start off with, I think we need to have an understanding of why. I mean, you're pregnant, you get COVID, is that something to be concerned about? And so Claire's going to outline why we have looked at this disease in pregnancy and why we're concerned about it.
Thanks, Vijay. So, I mean, most of you all are very aware about the potential risks of COVID, whether you're pregnant or not. But the focus specifically thinking about what it might mean for you during pregnancy is why we're here to talk about vaccination and what it means for you. So pregnancy is a state where you're at risk of becoming more unwell. So we know that you're at no more risk of getting COVID because you're pregnant. Just because you're pregnant doesn't mean that you're going to catch the infection any more than anyone else. But if you get it, potentially you can become more unwell. Now, most mums that get COVID-19 in pregnancy will just have a mild disease. So they'll get the symptoms that we've heard about of a cough, loss of sense of taste and smell. You might get fevers, you might get a bit of short of breath, but on the whole, you'll be able to stay at home and will recover within the space of a couple of weeks. And so that happens for about 2/3 of mums. But there are a proportion of women that won't be the case, and they will end up needing to go to hospital. And it looks like about a third of women, especially with the Delta variant, if you're pregnant, about a third of mums will end up in hospital, either because they're giving birth and they have COVID, or because they become unwell and they need to have extra support. And that support might be breathing support, just some oxygen, or it might be that they need to have more support in terms of needing to go to an intensive care unit. And when we look at pregnant women versus women about the same age that have a similar kind of lifestyle but are not pregnant, there's about a 2 times the risk of needing to go to the intensive care unit if you're pregnant. And that's why we're so worried about pregnant women, is because that's not a situation we want our pregnant mums to be in. And unfortunately, it's not just what happens to the mum, because obviously when you're pregnant, we've got to think about the baby as well. And if you're in that group of patients that become more severely unwell and need to have extra support, then there is an increased risk of problems for the pregnancy. And the things that we worry about are the risk of needing to give birth early. And that might be because mum's too unwell to stay pregnant, and we think the safest thing for both mum and bub is to be delivered. Or it may be that you go into labour a little bit early, although not many mums seem to do that. It's normally because we're concerned about the mother's health and the baby's health, and saying that the best thing is for the baby to be out. And that might be fine at the end of pregnancy, not a big deal. But if it happens earlier in the pregnancy, it does mean having a preterm baby. And the risk of that is definitely 2 to 3 times higher than it would be if you didn't have COVID-19 in pregnancy. There's a very small risk of the baby passing away. So what we talk about is stillbirth. And that risk is very small numbers overall, but is more than if you didn't have COVID-19 in pregnancy. So we're concerned both about the mum and the baby. And it's hard to know whether you're going to be one of the mums that becomes more unwell. And that's why we think about providing care and vaccination to everybody that's potentially at risk. We do know some mums have risk factors that mean that they are more likely to become unwell than others. So that might be if you're a little bit older, might be if you're overweight, might be if you have some underlying health conditions that mean that if you get sick, you're more likely to get more unwell. So that might be if you've got heart problems, diabetes, blood pressure problems, that they just put you at a little bit more risk. And so certainly for those pregnancies, the benefit of vaccination is even greater than if you're starting pregnancy without any other problems. The other thing, just in terms of pregnancy timing and risks, is that you need to think about when mums become unwell if they get COVID-19. That tends to be towards the end of pregnancy. So after 28 weeks is when you're more at risk of severe disease. So again, thinking about when we might want to vaccinate or when you might consider being vaccinated, obviously doing a little bit earlier in pregnancy before you get to that stage is important to protect you at that vulnerable period in time. So that's a kind of summation of what might happen to mum and baby. As I say, hopefully most mums just have a mild disease with no pregnancy complications, but we are worried about mums that may become more unwell because they're pregnant. Thanks, Vijay.
Claire, one of the things as well is the influenza story.
Yeah, I can hear you. Yep.
Can you hear me? And I remember back in time when you had this sort of perception that flu was a sort of mild illness. It was like having a cold, and then flu vax came along, and you thought, well, why would I take that? This is outside of pregnancy. And then I got flu, and I understood what flu was. And so in the same way that the vast majority of people who have the flu will have a sort of relatively mild illness and they'll be fine. But when you get it and you really get it, then you can be really crook. And we learnt more about that in pregnancy as well. And we saw that women who get the flu in pregnancy can become very, very unwell. And so we started that recommendation to have a flu vaccination. And now it's something that is an accepted part of pregnancy and has been for a very long time. And the other one, of course, is pertussis vaccination. But I think it's in link to what you've just been talking about is emphasizing that some of these illnesses, respiratory illnesses in particular, do affect have the potential to affect pregnant women in a far more significant way.
Yeah, I think that's something, as you say, it's not just COVID that can do that. So flu is the other one that we learned a lot about, but it is important because women's bodies go through so many changes during pregnancy. And I think most women that have been pregnant or are pregnant now will know that they feel short of breath even just doing the simplest things, and that's a reflection of what's happening within their lungs and within their heart system. You're more likely to get out of puff doing minor things. So if you just add an infection on top of that, whether it's COVID or flu, it's very quickly that you can start to understand why you might become more unwell quicker than if you were your normal self that's maybe running 5Ks 2 or 3 times a week. Pregnancy really knocks you around a little bit like that. So it's very understandable why becoming unwell would cause more problems during pregnancy than it would outside. And it's important that we do recognise pregnant women are much more at risk than non-pregnant women of becoming more unwell because of these changes that are happening in their body during pregnancy.
So there's a logic to it. It's not, that COVID will make you unwell, potentially can make you unwell in pregnancy. So as everyone on the call knows, that we do things like we have lockdowns, or we do social distancing, or we wear masks, or we do hand hygiene in a way to reduce the spread of COVID. But unfortunately, what appears to be happening and what we've seen happen overseas is, despite all of those measures, particularly with the Delta strain, this virus spreads and it doesn't discriminate. And one can try to do everything that you can, sort of isolate yourself, but at some point in time that can be breached. And so I think that that's also an important point in this discussion, if we're sort of following a lot of is to say that one cannot assume that you will not be exposed to COVID at some point in time. And as Claire said, if you do get COVID, then if you're a pregnant person, that you're at risk of significant illness. And also, I think to emphasise, because we're talking about people who are planning to get pregnant, and we're talking about people who are breastfeeding, that those people are also at risk of serious illness as well. So we can't say that. For the entire community, COVID should be seen as a potentially serious illness. So we come to the next part, which is vaccine. So what are the vaccines? The two main groups of vaccinations that are available and that we'll talk about and that are available in Australia are mRNA vaccines and viral vector vaccines. So the mRNA vaccines that you're familiar with are Pfizer and soon to arrive in Australia, Mrna. They're the two brand names. And mRNA vaccines work by, you will have seen those pictures of the coronavirus, and the corona is made up of these little proteins that are called spike proteins. And the mRNA vaccine, when injected into a person, is taken up in the lymph nodes of the cells, and then creates a messenger RNA that then creates an antibody to the spike protein. And it doesn't enter into the nucleus of the cell. It doesn't actually alter the cell as such. It just gives a code and says, hey, can you make this particular antibody? And once it's made the antibody, or once that message has been sent, the messenger RNA actually disintegrates and it's gone. The viral vector vaccine is similar to other vaccines that we use, where we get a vector, we get something that can carry the message for us. And in this case, it's what's called an adenovirus, which is a particular virus that is found that infects chimpanzees but doesn't infect humans. So it can't cause an infection in us. And we put that same message in that cell, and then we can, or that virus, and then it can be carried to thanks Simone. Then you put me off, Simone. So it then gets carried, and it does exactly the same thing. Now you will have heard advice, and remember, let's talk about them as 3 different groups: people who are trying to get pregnant, and so that will be men and women involved in making a baby, women who are pregnant, and those who are breastfeeding. So we know that, and the recommendation has been for either vaccine outside of pregnancy, and that is because we don't have any evidence at all. And in fact, we now have quite a lot of evidence, and Claire will talk to the volume of evidence that we have that shows that it has no impact on the sperm, no impact on the egg, no impact on fertility, no impact if you're having IVF, no impact on the number of eggs that are collected. In pregnancy, we have given advice to use an mRNA vaccine, Pfizer initially, Moderna when it arrives, because really quite simply because that's where we have the evidence. And if we're going to give advice, then we should give the advice based on the evidence that we have. Probably a viral vector vaccine, AstraZeneca, is fine. And that does relate to that issue of I've had AstraZeneca and now I'm pregnant, what shall I do? And we'll address that a little later on. But in pregnancy, we know that there is no evidence that that mRNA vaccine, because of the way that it works, and this is where we use a concept called biological plausibility. Does it make sense? Is there a logic as to why it might harm you or harm a baby? And there really isn't. We don't have any evidence of an increased risk of miscarriage. We don't have an increased risk of any damage to the baby, any impact on the pregnancy health of the mother, any untoward effects when it comes to the time of birth. But as Claire outlined, we do have that evidence for if you get COVID. And similarly, when we come to pregnancy, both vaccines, we don't have any evidence that they are harmful to the baby. And now you're in that population, or these two groups of populations, in which you are an adult on the planet who is at risk of being exposed to COVID, a disease that you don't want to get. So I think probably one of the commonest questions that we get asked is, but where did you get your evidence? How can you, is it something that you that's just your opinion? It's just a group of doctors who had a chat and this is what you came up with. And I think we know that people are skeptical about the advice. But Claire, where did we get the evidence from?
Yeah, so there's quite a lot of evidence now, and so we're talking about tens of thousands of pregnant mums that have been vaccinated, and that the data is being collected on. And a lot of that has come from the US, because obviously they suffered with huge waves of COVID last year, big numbers, they have a big population, and they were very proactive at going out and vaccinating their population last year and into the early part of this year. So there's an organization in the US that you probably would have heard of called the CDC. And they collect data about infectious diseases, amongst other things. And they've been collecting data on mums that have been vaccinated, or people that have been vaccinated during pregnancy. So they've, whenever you get your vaccine, same as here, you get your little message on your text message a few days later saying, how did it go? Do you have any side effects? So a similar system's being used there. But one of the questions that's asked in their system is, are you pregnant? At the time that you get your vaccination. So I checked just before we came online, and they've got now data for 155,000 pregnant mums. And so that's a huge number. Now, the data they have is not complete pregnancy outcome data. It's just telling us about what happened around the time of vaccination. So that's the first set of information that they've been collecting. The second set of information is they've gone to some of those mums and said, look, we really want some more detail about what happened during your pregnancy. Are you happy for us to contact you and find out when you were vaccinated, what effects it might have had on you, what the pregnancy outcome was, what your doctors think about what happened in the pregnancy? And so they've pulled that data together as well. And they've got less numbers because that's a lot of work to get that information, but they've got, again, over 5,000 mums where they've got that information about what exactly happened in their pregnancy and when their babies were born. So that's where the biggest bulk of our information has come from. The other part of that system is, which runs in all the countries that, like Australia, where you are vaccinating your population, is there's a reporting system. So if something goes wrong, so if you get a rash and you feel unwell, or your doctor says something else has happened, you've got chest pain, then you report it to a reporting system, and they collect all that information. And some of it they'll say, actually, this has got nothing to do with the vaccine. You just walked in front of a car that day. That's why you've got a broken leg. And other things they'll say, well, actually, no, this is a result of you having the vaccine. And that's where we look for those little signals over time to say, is there any trends that seem to be happening during pregnancy for mums that have been vaccinated? And when we look at that data from the US of all those three different kind of schemes, we can see that there have been no signals of any concern about an increased risk of miscarriage, increased risk of any anomalies, so changes in the way the baby develops, or any adverse effects in the mums as well. So very reassuring. Slight differences in terms of side effects around the time of getting a vaccine. Pregnant mums seem to actually do a little bit better in terms of most of the side effects. They have slightly less than non-pregnant mums, but otherwise no really concerning flags. And just to talk briefly about the AstraZeneca one, we do have emerging data on that. So there's 62,000 mums in the UK that have been vaccinated during pregnancy. Lost BJ under a table. So 62,000 pregnant mums in the UK, and some of them had AstraZeneca before their recommendations changed. So there was more AstraZeneca being used in the UK, and then as some of the trends and recommendations have sort of shifted over the last 6 months, that has now gone to probably being more of those are being Pfizer as well. So again, there's big data sets being collected internationally. Less so in Australia because we're coming to this a little bit later. But again, this information is collected. If there seems to be any signal of concern, then it's recognised and acted on. And at the moment, there has been nothing. And the important thing is big numbers, hundreds of thousands. We're seeing no adverse effects. But COVID, hundreds of thousands, we're seeing adverse effects if you get the infection during pregnancy. So that balance is really important in terms of what are your risks of getting disease and becoming unwell and pregnancy effects on your baby, versus the kind of what we're seeing of being very reassuring from the vaccine point of view. Now, it's important and something everyone always asked about is what are the long-term effects? And obviously we can't comment on the long-term effects because this is a new disease. This is a new vaccine. We only have information for 18 months. So, and really just from the vaccine point of view for the last year, we don't have 5-10-year outcomes for babies that were vaccinated with the COVID vaccine. But as Vijay said, biological plausibility, there's nothing to suggest from other vaccine studies that have been done that this would have an impact on the long-term outcomes, if otherwise the pregnancy outcomes are very reassuring. So we can't give you that answer. We can't give you the 100% reassurance about 10-year time outcomes, but I think we've got to think about what are the issues now, and what those impacts might be for the pregnancy if you got COVID versus what we're thinking about the vaccine. So that's, kind of, I think, the important things there. There's lots of questions coming up.
Yeah, we can see, and we will respond to those questions, and I think that they're all fair. And it's interesting when you said 155,000. I just read some statistic today that in Australia there's roughly about 300,000 births per year, and so when you're talking 155, you're talking a huge number which we can draw on when we compare it to our population having that number of babies per year or pregnancies per year. So I think that those are very big numbers. Claire, what about sort of protection for the baby from vaccination? One of the things that we know is that if you get COVID infection, pregnant or non-pregnant, you develop antibodies against COVID. But if you have vaccination, in fact, your antibody response is even better than if you'd had the natural disease. Does that have a benefit for the baby?
Yeah, so I mean, certainly we know that whether you get the infection or you get the vaccine, you'll make antibodies, and those antibodies cross the placenta. So the vaccine doesn't cross the placenta, the virus doesn't cross the placenta, but the antibodies that your body makes to fight the infection do cross the placenta. And that's why we give you the whooping cough vaccine during pregnancy, partly why we give you the flu, although that's mainly to protect the mum, but the whooping cough is really just to protect the baby because it's the baby we don't want to get whooping cough. So we know this transfer of antibodies going to the baby is really important for protecting the baby. So yes, that does happen. We've got good studies showing you can collect some of the baby's blood from the cord at the time of birth, so not from the baby, but it's the baby's blood, and the antibodies are there if the mum's been vaccinated during pregnancy. What that means in terms of protection for the baby, we don't really know, and how long that protection lasts, we still don't really know. And that's because actually babies generally do quite well, and so the risk of a baby becoming sick if it gets infected with COVID is low. It's not zero, but it's very low. And so although we've got all this great data showing that mums are being protected, we don't really know whether that how long that will last in the baby or protect it. But we do know that the antibodies go there. They go there in the breast milk as the other things are the benefits of mean, the benefits of breastfeeding in general, but being vaccinated if you're breastfeeding, even if you weren't vaccinated during pregnancy, your body will make antibodies. The antibodies will go through the breast milk and will provide some protection for the baby as well. So hopefully babies don't get sick, but certainly it can help to prevent them becoming more unwell if they were to get sick, or hopefully prevent them from getting sick at all. So you are getting a double boost of protecting mum and protecting baby by being vaccinated, ideally during pregnancy, because the vaccines, the amount of antibodies that go to the baby is more if you're pregnant, but you still get a protection with breastfeeding as well.
And emphasising that point is that while COVID doesn't cross the placenta, if the mother becomes unwell with COVID, then ultimately that's not good for the baby. You know, one, that the baby could be born earlier, two, and we don't want to overemphasize it, but we need to state it, that there's a slightly increased risk of stillbirth. But three, even if there isn't a direct impact on the baby, well, there will be really, because you're the incubator for that child. And if the incubator isn't looked after, then, you know, you being on a ventilator, you needing to have serious medications or to be cared for in intensive care. Even in other circumstances, when we have our pregnant patients in those in intensive care, we know that it isn't a good setting for their baby.
Yeah, and we know that that has effects both preterm, like both at birth and in the long term. So a baby that's been exposed to an environment doesn't have enough oxygen, or that where there's been an infection, those babies are potentially at risk of long-term outcomes. Not all long-term bad outcomes, not all of them. Many of them will be absolutely fine, but there will be some that will have developmental problems, so learning, schooling problems, because they were exposed to infection during pregnancy. So not the infection going to them, but just the mother being unwell, having signs of low oxygen, signs of infection in her blood, can have an effect on the long-term outcomes for that baby. So that's another sort of long-term thing that we can potentially prevent if we can prevent the mum from getting sick during the pregnancy.
And I think it's maybe another thing to talk about or to think about is that in the end, all the pregnancy care, whether it's care that the mother provides for herself and her baby herself, or professional care that we provide for pregnant women and their babies, is designed to look after, or the objective is to look after that mother and that baby. And a lot of the things that we do carry an element of risk, in the sense that, and sometimes it's known risk and sometimes it's unknown risk. And we don't know everything about everything. And we've had to go through these processes with a lot of the things that we have had to learn about pregnancy. Sometimes it's been a disease state that we didn't really know a lot about, and now by researching it and talking about it, and we've learned more. Diabetes in pregnancy would be a good example, where there was a fairly poor understanding of it in the past, and then a recognition of how to manage it. And then people questioned it as to whether you should have really tight control of sugars or whether you could be a little bit lax, whether in fact it was better to let the higher sugar go across to the baby because that gave the baby sugar, and all sorts of discussions like that. And I think that COVID is an example. I think we should be careful about seeing it as such a novel disease in a sense. I think we should go back and remember it's just, in a way, another respiratory disease. But like another respiratory disease, which is influenza, the consequences can be really significant. And similarly, to see mRNA vaccine, yes, I think we need to be careful about some of the language that's used around that as well, because this concept that it's a new vaccine is not entirely true. We have had mRNA vaccines developed before. It's not entirely new technology, correct?
Yeah, I mean, the mRNA vaccines have been sort of being developed for the last 15 years. So they've been, and including being developed for some pregnancy conditions as well. So there's some that are pretty close to coming to market for things that we want to protect pregnant mums and their babies from already, using exactly the same technology. The difference between what sort of has traditionally happened with vaccine trials and what's happened here is that the huge amount of money was suddenly available to accelerate the process. And so people were working internationally together. There were big groups coming together. The governments were putting money in to say, let's sort of tip the balance in terms of how quickly this new technology, or this technology we've known about for a long time, can be used, because it's a great technology for what we're trying to do. But a lot of the work had already been done well before COVID existed. It's just that they were then able to adapt it quite quickly for COVID, and there was facilities and funding and also people with the disease that we were able to test it quite quickly, because typically drug or vaccine trials will take much longer, because you're often looking at a population or group of people that's quite a bit smaller that are affected by the disease. And so especially with vaccines, if there's not much of the disease out in the community, you've got to have a lot of people in your trial to say, oh, this vaccine really works, because what you want to know, is it preventing disease? And so the disease has to be out there. Now, not for a good reason, but there was a lot of COVID out there. So you can very quickly reach those points in a trial where you can say, oh, we've recruited 100,000 people and we know how effective this is. Whereas for a lot of vaccine trials in the past, that may have taken 5 years to get 100,000 people included. We've been able to do it much quicker. So the technology and the process of the vaccine trials hasn't changed. It's just a pandemic allowed it to happen in a short time frame that would normally take a bit longer.
And you do it in parallel. They changed the approach, whereas in the past it was done sequentially, and that takes a much longer time.
Yeah. So, yeah.
So Claire, just going to some of the questions that I think, because Claire and I have been spending our lives doing webinars and having these discussions, we're quite well acquainted with many of the questions, and they're common questions and they're repeated ones. And I want to really emphasize that they're fair questions. We're not in any way being judgmental about people who have a different perspective. We want to have those questions. All pregnant women have a right, all patients, all people have a right to ask questions and to have them answered to the best of our ability. And so that's what we'll try and do now. And one of the questions I think is, when should you have, you're a pregnant woman, you found out that you're pregnant. A lot of the people on the call tonight will be pregnant. When should you have your vaccine?
So any time in pregnancy is safe. So we're recommending that you have it first, second, third trimester. And I think at the moment, especially if you're in New South Wales, you just want to, I've lost Vijay. You want to get it so you can prevent disease when it's available to you. So that's the best time to get it. But we do appreciate that mums in the first trimester might be a bit more anxious, because this is a time when the baby's doing all the key development of making its organs. And when we are a bit more concerned about what exposures you might have during those first 12 weeks of pregnancy to drugs or alcohol or these kind of things. So we can understand why some mums might say, I'm concerned in the first 12 weeks. And we've got to balance that against the risk of becoming unwell with COVID is not that great during those first 12 weeks. So it's also perfectly reasonable to say, look, I might just wait till I'm a little bit further along, 12 or 13 weeks, had my first scan, I know everything's going okay, and I won't be worried that this is related to the vaccine. So we don't have any safety concerns about it in the first trimester, but we acknowledge that some mums might want to delay it until they're a little bit further on in the pregnancy, and that's absolutely fine. We would recommend that if possible, you do get it before the latter stages of pregnancy, so that kind of after 28 weeks mark. And that's really because we want you to prevent those women becoming more severely unwell. And that's the kind of tipping point where your body's really starting to change, and the effects on your heart and lungs are greater from being pregnant, and therefore you're more likely to get unwell. So if you can get vaccinated before then, that's great. The other part of that, if we are thinking about antibody transfer, is that you do need a bit of time for your body to make an immune response, to make those antibodies, and then to pass them on to the baby. So if we think about the whooping cough vaccine, we say, well, look, we recommend that after 20 weeks, but ideally before, in that kind of 20 to 30 week mark, because that's the optimum time for passing the antibodies on to the baby. If you don't get the opportunity to get it until you're 36 weeks, 38 weeks, I still think go ahead and get it if it can prevent you being affected around the time of delivery. That's really important. But there might be slightly less antibody transfer that happens at that time. But that information is still coming to us. So I think really just focusing on when you can get it. And I know that can be a challenge, actually accessing the vaccine sometimes through the various different channels, and making sure that you are prioritized as a pregnant woman. But so it's a practicality point of view. get it when you can, but certainly ideally within the second and third trimester would be really important. Have we still lost Vijay?
I think we have, unfortunately, Claire, so hopefully he will join us
right.
very, very soon.
Yeah. Talking. I guess the other question, some people have talked about fertility, so we might just jump back to fertility and then we can talk more about pregnancy timing. So fertility questions are obviously important. It does, from a recommendation point of view, obviously if you're considering pregnancy, you don't have the same risks as if you are pregnant. But people are obviously concerned about what might be the impact on my chance of falling pregnant if I have the vaccine. So if we kind of break it down into different groups, so there's males. There's been a number of studies done looking at sperm production and quality of sperm, and most of those are from groups that have been doing IVF, but they are looking at men that are planning pregnancy. And there's been no difference in terms of sperm quality, number, any of the other indices that we would be caring about in terms of your likelihood of falling pregnant in men that have been vaccinated. So they've taken samples before you have your vaccine, they take samples again afterwards, and they're all the same. In opposition to that, there have been men that have had COVID infection. We know that actually does appear to reduce sperm count. It can cause inflammation and reduce fertility. So COVID infection can cause problems with sperm and ability to fall pregnant, but the vaccine hasn't been shown to. In mums, there's been studies done. Again, a lot of it's coming from people that are undergoing fertility treatment because you can very carefully monitor them. But again, no difference in terms of how well they respond to fertility treatment. So how many eggs they produce, what their chances are of falling pregnant with an IVF cycle. That's all been the same before and after vaccinations as well. So very reassuring when you're looking at really studying in depth what's happening with people. And again, no information from people that are trying to get pregnant. It's hard when it's just anecdotal, so you have to look at these studies where they're really focusing on a particular group of patients. But again, very reassuring that there's no risk with the vaccine of it affecting your chance of getting pregnant. And obviously, if you're vaccinated before you're pregnant, then that can be very reassuring going into pregnancy, knowing that hopefully that vaccination immunity will cover you through the whole pregnancy, protect you and the baby through the pregnancy as well. Still missing Vijay. So just sort of then moving on, I'll just talk maybe a little bit about breastfeeding. So at the other end of the spectrum. So the recommendations for breastfeeding are slightly different. So as I said, and Vijay said earlier, if you are pregnant, we recommend focusing on the Pfizer and the Mrna vaccine. If you're now you've had your baby and now you're breastfeeding and now you're thinking about vaccination, there's not the same recommendations apply. So you can have any vaccine, and so that does mean you can have AstraZeneca if that's the one that's available to you. And that's because the data is, there's probably a little bit less data around breastfeeding in terms of what big groups of people. So we've got lots of big groups of pregnancy, but not quite so many big groups of breastfeeding mums. But the data is very similar across those that have had an mRNA vaccine, such as Pfizer and Moderna, and those that have had AstraZeneca. And so there's antibody transfer into the breast milk, and that can go to the baby as well. And that antibodies we know last certainly as long as you're breastfeeding. It's unclear whether those antibodies are sustained once you've ceased breastfeeding, but certainly while you are breastfeeding, that is providing some protection for the baby, and so that's important. Just going through some other questions that have kind of come up and that we've talked about in the past. There was a question I think someone posted earlier about what happens if you've had AstraZeneca in either before you were pregnant or before the recommendations changed, and then what do you do about your second dose? And again, we can understand why people would be anxious about making decisions around this when we're saying the only option is, hi Vijay.
Sorry.
All right. So we've just touched on fertility, touched a bit on breastfeeding, and I'm just talking about AstraZeneca as your first dose. What do you do for your second dose? So, and we talked about timing as well, when was the right time to have it. So I think that's what you've missed. But yeah, the AstraZeneca first dose, So recommendations are you can have another dose of AstraZeneca if you have had the first dose and not had any adverse reactions to it. That's fine. You can go ahead and have the second dose. Or you can have Pfizer as your second dose, or Moderna. You don't need to have another dose at this point in time of the different vaccine that you have. Now that may change in 6 to 12 months, but at the moment you would be considered fully vaccinated if you have an AstraZeneca followed by a Pfizer or Moderna. We don't have as much evidence about what that means for people that have had the mixed dosing. So we've got lots of evidence about just having one type where you've had two of the same type of drug. We don't have as much about it if you had two, but again, theoretically, it shouldn't be causing any problem from a pregnancy point of view. The only thing that you might notice is you get worse side effects at the time of the vaccination. So you're a little bit more likely to get a fever, a sore arm, feel a little bit more fatigued and achy muscles than if you have the same dose, the same drug for both your doses. So that probably is causing a better immune response potentially. We don't have all that information, but it also might make you feel a little bit more unwell at the time that you get the vaccination done. But from a safety point of view, it's reasonable. And you just need to liaise with your local hub or wherever you're getting your vaccine about how best to proceed with going forward with that. But both are very reasonable options to pursue.
And what do you do, Claire, if you do get a fever or you have got a sore arm or you feel unwell?
Yeah, so absolutely fine to take paracetamol, to take Panadol. It's safe in pregnancy. It can bring down a fever. I'm not very keen on mums having fevers in pregnancy. So if you do start to feel like you are getting one, it's a very sensible idea to take some Panadol, and normally you'll just need 1 or 2 doses of that and things will settle down pretty quickly. Obviously, if you feel more unwell and you're concerned, you should see your doctor just to make sure there's nothing else going on. But yeah, very safe to take that, and that should relieve those kind of minor side effects that you might get from having the vaccine.
And just, I'm sorry that I got cut out, but when you were talking about fertility, did you address sort of timing in terms of when you're trying to conceive? It doesn't matter what part of the cycle you have your vaccination in, or whether you're about to do an IVF cycle, or
no, I didn't really go into that. So yeah, I mean, I guess the main thing is it doesn't matter too much, really, is the gist to it. The only thing, so whether you're planning, whether you're about to start, whether you're thinking about it in 3 to 6 months' time, it's the point is to get vaccinated, not to delay because of concerns about the vaccine, and not to delay pregnancy. The only bit that we're recommending is if you're actually just about to have a fertility treatment within the next 7 days, or you've just had it within the last 7 days, that's probably the time to avoid it. And that's not because we think there's any problems with the vaccine and fertility, but just that sometimes those fertility treatments can make you feel a little bit unwell. And it's hard to tell what's going on. So if you've got a fever after an IVF procedure, is it because you've had an IVF procedure, or is it because you've had a vaccine? And we want to make sure that we weren't missing something that was related to the IVF procedure. So right at the time of a procedure, it's probably a good idea to avoid it, but not because of concerns about the vaccine. But other than that, it's the time is to get it whenever you can.
And we applied that same logic to the advice around timing in pregnancy related to the influenza vaccine or the whooping cough vaccine as well, didn't we? Is to say, yep, have them a week apart, not because they're going to interact with one another or they're going to do any harm. It's just that if you have a reaction, then we know what it was that you had, and then we can understand that reaction and respond to it.
And that's important for people thinking about when they're trying to, because we're asking you to get lots of vaccines in pregnancy now, like your doctor's saying, have you had this one, this one, this one? And you can have your flu and your whooping cough at the same time. That's absolutely fine, but you do need a 7-day gap for when you have your COVID. So just if you're having them around about the same time, just to plan out your diary a little bit to make sure that you have maybe your COVID, and a week or two later you have your flu and whooping cough, and then you can have your next COVID after that. So they just shouldn't be within 7 days of each other, but otherwise there's no restrictions around the time.
Do we have any evidence in terms of the COVID infection itself that has a direct increase, that has a direct impact on fertility or miscarriage or harm to baby?
Yep, so from a fertility point of view, there is emerging evidence that it does affect fertility, certainly male fertility, less so impact from a female fertility point of view, but not as much information around that. COVID in early pregnancy doesn't seem to increase your risk of miscarriage. So most people that have COVID infection in that first 20 weeks, it's unlikely to have an impact on the baby in terms of being any more at risk of having a miscarriage or of the baby developing differently because of COVID-19 in pregnancy. So most of the data is quite reassuring about that. And that's also the time that mums often aren't getting so unwell. So it kind of fits with that too, that it's less likely to have an impact on the pregnancy. It's the later impacts on pregnancy that are more important.
And similarly, just to, because I can see questions in the chat, is just to emphasize again that we do have data that I think that, again, start with biological plausibility with the vaccine and say, is there a logic as to why it would cause harm? That we don't have evidence that there's an increased risk of miscarriage with vaccination.
Yeah, so no increased risk of miscarriage with vaccination, like from good large numbers, that it's the same if not lower than population, like than what you'd expect in people that weren't being vaccinated.
Claire, from what we've been talking about in the Clinical Evidence Taskforce, and I'm veering, of course, just a tiny bit, is that for women who are pregnant, what should be their anticipation of pregnancy in the time of COVID? You know, in terms of their visits, in terms of their usual care, in terms of what's going to happen when they birth their baby afterwards, things like skin-to-skin contact and delayed cord clamping and breastfeeding. Should that be impacted by the circumstances that we're in at the moment?
Yeah, so I think it's really hard for all pregnant mums at the moment. There's a lot of uncertainty, even though we're 18 months into this, but especially if you're in Sydney, this is the first time really had to go through being pregnant during the pandemic. Us in Victoria, we did it last year, so we know what it's like. But it's a really hard time because there are some changes. The important thing is to try and keep what we can normal and what's safe to keep normal. But there will be ways that, and sort of your care, clinic care is being delivered differently, more likely to have consults by phone or by telehealth than traditionally everyone comes in for every doctor's appointment. I think there's probably slight variations between what's happening in Victoria and what's happening in Sydney, but certainly there's definitely a trend to try and keep you out of the hospital as much as we can during your pregnancy and only bringing you in when we need to. And then around the time of birth, obviously there's different changes in terms of visitor policies and how many people can come into the hospital and be with you. Things that Vijay is sort of referring to after birth that are really important and are important for you and your baby are skin-to-skin contact after birth, so that should be maintained whether you've got COVID or not. So a lot of these things are just trying to keep pregnant mums safe by not exposing you to COVID. But then if we're actually talking about if you were to get COVID around the time of delivery, that can be quite a stressful thing because everyone's all dressed up in the extra layers of PPE. But we try and really focus on keeping as much normal as you can. So normal birth is the goal, if that was what was always the goal. I mean, just whatever the pregnancy plan originally was, it shouldn't be changed on the basis of COVID. If you got the infection, your baby should be able to be breastfed by you. You should have skin to skin. The cord should be allowed to have delayed blood flow before you, so we'll normally say about a minute before you clamp the cord. All those things that would normally happen shouldn't be changed because you have COVID-19. But some of the sort of more external things, like how people are dressed in the room, how many people can come in, are very, very different and are obviously something you really want to try and avoid. So we recognise that it's a stressful and scary time for a lot of pregnant mums with the uncertainty of what's my delivery going to look like? Is it going to be different from what I'd thought about 2 years ago or what I had with my last baby? Yeah, probably there are things that are different, but it's important you talk to your care providers and your team about what things are important to you that we can keep as normal as possible and try and facilitate.
They're more likely to be different if you've got COVID than if you don't have COVID. And I think, look, there's so many questions that I can see in the chat. There's a sort of bit of dueling papers. You know, I read this article and then we say, well, I read that article. And maybe, and I'm not being dismissive of that, but the group that we sit on is called the Clinical Evidence Taskforce. And it was a funded official body and it is charged with looking at all of the evidence. And what they do is that they get every single paper that is accessible from around the world. And I think COVID, the disease itself and the circumstances that we're in, has produced more papers than at any time in history. And we're talking hundreds of thousands of papers. And this group has to go through every single one. And we have a very separate pregnancy panel that looks at those papers after it's been looked at by all the general papers. And so we have to look at the general papers as well as the pregnancy ones as well. And that's the sort of level of analysis of the information that's being done. It isn't sort of lighthearted. And so remember, if you found a paper that suggests that there might have been a harm or a benefit, that what we're doing is that we're bringing all the papers together, and then you get cumulative data. And instead of looking at in 10 people this happened, we're looking at in 10 and 10 and 10 and 10 until we've got 100 people or 100,000 people, and then your statistics start to become meaningful. So it's quite risky to just look at one paper, either to support an argument or to try to defeat it. I think that it's important to realise that what you need is accumulated, and I don't say this in any silly way. I mean, but people like Clare, that's as academics, the rigour that's required. You're not allowed to just say I think. You have to be able to defend your position, and so that's where we're coming from.
And I think that's also important to recognise that that's also changed over time. And so people say, well, why did our recommendations change, or why are we saying different things at different times, like from what we said 6 months ago? But that evidence is all accumulating. And so we're putting all that evidence together as it grows. And so some things may change over that time. We may say, well, at this point we were sitting on the fence because we really didn't have anything to push us one way or another. But now we've got hundreds of papers telling us that this is the right thing to do. So now our recommendations are changing because we've got new evidence that's building, and this is a pandemic, so it is building. And so we recognize that we don't always have all the answers to all the questions, but that might change hopefully over time, that as information gathers and as we put it all together, we can make a clearer recommendation, as we have done with vaccines. So that's why initially we had to wait for that evidence before we really said what we thought was going to be right, and now is that, well, look, this evidence has built. We feel confident recommending vaccinations with all this data that's been collected over the last 6 to 9 months, and this is where we're sitting now. And some things might change, maybe new things that come out in a year's time that say, look, now we're going to tell you something different, whether it's about vaccines or how to look after your baby or whatever, but you need to be able to be always keeping up to date, and that's really important. So you don't stick at one point in time, you look at what's happening as that information becomes available.
And knowledge evolves, and I think that where evidence is coming from in Australia, and I think that's where we have huge benefit, is that it is coming from these learned bodies, and it is coming from researchers and medical people and scientists. And of course, the other thing that all of us get is a politicised environment as well, and everything that goes there about whether you should have lockdowns or whether borders should open and all those sorts of things. We're not involved in that conversation. That's not part of our issue. Our issue is to look at the science, to look at pregnant women, because that's what we do every day. That's what our job is. And so we've been sticking to our knitting then, and that's all that we're commenting on. And we have been very careful not to get involved in those issues which have a discussion at a different level. And we've been confident enough to disagree with government or to disagree with health ministers in terms of their directive. We've been confident enough to give them advice when we believe that it was the appropriate advice to give. But how then it's administered is beyond the control of the medical system, and that isn't what our role is. Andre, I was wondering whether you had a couple of questions that we're getting close to the hour, but whether there were any things that you thought we hadn't covered.
Yeah, thank you, Vijay, and thank you, Claire. I think we have. I'll just go through them. I think we've talked about mixed dosing. Claire, you talked about mixed dosing. So these are the questions we had pre the event tonight about the mixed dosing. So I think you've spoken about that, Claire. Yeah, you think you've covered that?
Happy. Yep.
Yeah. Regarding the AZ vaccine and passing on antibodies to an infant, I think we've spoken about that, about does this occur and is it likely to prevent COVID infection in the breastfed infant as well?
Yes. a little bit less evidence for AstraZeneca than there is for Pfizer, just in terms of studies. But biologically, you're making the antibodies, they should pass through the breast milk. So no difference would be expected, but we don't have as much data around that. But no vaccine goes into the breast milk. That has been studied.
Yeah. The earliest time we can expect, I know, we've talked about fertility, and we've talked about that. We've covered fertility. There's a question here about 30 weeks and a 20-week hospital appointment. They were advised by the midwife to wait to get vaccinated until after the baby is born, but is now being told that they should get vaccinated. What's changed? Has research changed? What's changed?
So I guess that's what we were just talking about in terms of the accumulation of evidence. So certainly, I think a lot of people have had that experience in early pregnancy. Our advice was wait and see. We'll tell you when we know more. And at the moment, that many months ago, that wasn't the recommendation. But now that we've got this data from overseas, and we're very fortunate in Australia that we've had this time to wait for other countries to learn many of the things about how to treat patients and how to vaccinate patients. And although it's horrible that we're in this situation right now, we are coming at it from a very different point actually than many other countries, because all this data and all this evidence is there. So that's why the recommendations changed, because we have new information that can drive those recommendations, and that's why we would encourage you to think about vaccination.
Yeah.
And I think everything else, to those questions we've covered there.
Yeah. Andre, I might just sort of pull it together a little bit, which is, I think we need to start off with pregnancy is a time of joy. It's a time of happiness. You're going to have a baby. We don't want to take away from any of that. And I do think that sadly over the last 18 months, pregnant or non-pregnant, we are at risk of having lost a lot of joy. And I could certainly say that for myself in some of the things that I feel that I've missed out on. And so for all of you that are listening tonight, I want to acknowledge that. And I want to acknowledge that particularly in pregnancy, when you're getting ready to welcome your baby, and pregnancy itself and the birth experience itself are wonderful times in your life, is that our objective is for you to enjoy that. COVID is a serious disease. I don't think that we can escape it. It's not just another cold. It's not just another flu. It is its own serious disease, whether you're pregnant or not pregnant. And if you are pregnant, then those risks are higher. And we have pregnant women on ventilators in New South Wales, and we don't want to have them there. And we know that you can become seriously unwell. So that fact, I think, is indisputable. We also know that vaccination reduces the risk of you being unwell. And I think that fact is indisputable, whether you're pregnant or non-pregnant, but particularly in pregnancy. And I believe, and I hope that we presented to you tonight, that thinking about how the vaccines were developed, how we have investigated them, the research that we've done and that we have distilled and gone through and argued over, has led to us being able to give you this advice that in pregnancy, when you're planning to be pregnant, when you're breastfeeding, that vaccines are safe. Confining mRNA vaccines to pregnancy, or pregnancy to mRNA vaccines, and that they will protect you and they will protect your baby. But as we have often said with these webinars, is that we recognise that you will get your own information, but we would encourage you to talk to a health professional. Midwives and doctors are constantly talking about this. We have our own fact sheets and guidance on how to talk about these issues. And you know, of course, you as a pregnant woman have every right. You as an autonomous individual have every right to ask those questions. And the last thing that I wanted to say was that I think that the other part of health that I think is critical is your mental health. And this is a time when we all feel anxious and we all feel worried, and that's something that we know can happen in pregnancy as well. And so any opportunity that I get, any platform that I'm allowed to speak on, I want to remind all women and all men to take care of their mental health as well. And so if these things are worrying you, then talk to someone. If you're feeling anxious, whether it's as a result of the pandemic or not, talk to somebody, because there are people there who will listen, who will understand, and who can help you to address those things. And we want your pregnancy to be a time of happiness and joy. So Claire, were there any final comments that you wanted to make?
No, I echo everything you say, and I think it's important for people to really, if they've got unanswered questions, this has been a short session. We've tried to cover as much as we can, but talk to your healthcare providers, ask the questions that are important to you, and make a decision with the information that you're given. We're here to provide what we can. There's lots of good resources out there, as Vijay said, but yeah, we haven't been able to answer everything, and we appreciate that. So please do speak to those people that are involved in your care that might be able to help to give you the information you need. And hopefully we can have many more women having healthy pregnancies, and we get out of this lockdown and pandemic before too long, and can get back to some sense of normality, whatever that may be, and enjoy our families and get to see them a bit more. So that's all. Thanks.
Thanks.
I'll just wrap up there and just say thank you very much, Vijay, and thank you, Claire, for your time. It is very much appreciated. And thanks to Nicole, the Northern Beaches Mums Group, and everyone who attended tonight for the opportunity. Before we go, just two quick things. Please visit our website, ranzcog.edu.au, and there you'll find all the information and advice. And of course, follow us on our social media channels, Facebook, Twitter, and Instagram. And finally, RANZCOG will be hosting its own webinar on COVID vaccination in pregnancy, breastfeeding, and those planning to be pregnant. It will be on next week, Wednesday, the 15th of September. So Wednesday, the 15th of September at 6 p.m. We'll hear from Claire and Vijay, so they'll be joining us again, and other experts as well. So go to our Facebook page and you'll find all the details and be able to register. It is the pinned post right at the top. And we look forward to seeing you there. But once again, thank you very much and have a good night.
Thank you.